Immunotherapy is got to be one of the most exciting developments in the last 50 years in cancer therapy, in my opinion. You know, I've been in the business for about 30 years and I've seen a lot of new developments, but nothing has really matched immunotherapy, because now we're seeing patients, even with very advanced disease, having long-term benefit, perhaps cure. And so we're really excited about that. Now the downside is right now we can only cure about maybe 20% of patients. We'd really like to expand that number to treat all patients. And so what we're looking at now is combining immunotherapy with things like oncolytic viruses, with things like other kinds of chemotherapy, for instance, to try to make a bigger impact on patients and make sure that we actually can treat as many patients successfully as possible. So immunotherapy is really interesting because it actually can be used in combination with many kinds of therapies, like chemotherapy and like radiation therapy. We're beginning to discover how these two kinds of treatments can synergize and work together. But we have ways to go there yet. Some kinds of chemotherapy, as you probably know, are very immunosuppressive. So we have to pick chemotherapies that attack the cancer without attacking the immune system. And when we do that and use them in combination, we can see some really outstanding results. With radiation therapy, again, depending upon how we time and sequence the immunotherapies, there can be a lot of synergy between these kinds of treatments. There's lots of kinds of immunotherapy. We're beginning to develop engineered T cells to attack the cancer. That's taking some of your immune cells out of your body, engineering them in such a way that they can specifically attack the cancer, and then putting them back into the patient. But there's also other kinds of immune therapies like what we call immune checkpoint inhibitors. These are antibodies which take the brakes off the immune system, really, or revitalize it. Sometimes what happens in a cancer patient is that the tumor has found a way to make the immune system go to sleep, to really paralyze the immune system. And what these antibodies can do is really revitalize that immune response and allow the patient to once again respond to their tumor. Viruses, on the other hand, are actually very good because they stimulate the immune system. They also cause the cancer to release what we call antigens that can stimulate immunity. So really, it's strategic combinations of these therapies are really what we're looking for in the future. And a lot of us in the field are very optimistic that we'll raise the number from 20% of patients that respond to much higher than that, especially in the near future. So I'm really excited about this field of research and development.